Hi, my name is Jessica Smith, and this is my article on the elderly and the fall risk. According to the Center of Disease Control and Prevention, an article written in 2015 states that each year 2.5 million older adults will be treated in the emergency department for a fall-related injury. 1 out of 5 will actually obtain a head injury or a broken bone. Studies show that falls in older adults are often caused by a decline in physiological factors or disease. These factors can be significantly decreased with proper assessment and prevention beforehand. First, we're going to talk about the many causes for physiological factors to decline. This is basically anything that makes the normal state of the body decline, and how this makes them vulnerable to falls. Second, we're going to focus on how assessment of both the older adult and their environment and how this can help detect and limit the amount of falls that may occur. Declines in the older adult health can increase the risk for a fall. One decline in health is being unable to maintain a balance or a proper gait. According to the NIH, an article written in 2013 called Falls in Older Adults states that these problems may be linked to a lack of exercise or to a neurological cause, arthritis, or other medical conditions and their treatments. Some of these conditions seen in the elderly population can cause malformations such as a poor posture, feet deformities, muscle weakness, and pain with mobility caused by these changes. Another health decline that is seen is a decrease in vision. These can be caused by glaucoma, cataracts, depth perceptions being off, the accommodation of light changing can cause a person to be able to fall in their environment. Another change is blood pressure. Blood pressure changes can be caused by diabetes, Parkinson's, and infection, all of these causing the blood pressure to drop, especially when the person is going from a sitting to a standing position quite fast. They become dizzy and lightheaded. Another one is the altered mental status of a patient. There is such things as dementia and Alzheimer's and urinary tract infections that cause a person to be confused. A couple of them are permanent, like Alzheimer's and dementia, and the other one is temporary, that can be treated by antibiotics, such as the UTI. But all of these can make it hard to identify the hazards in our environment, and if you're unable to tell when things are not safe, then you're more likely to fall. I'm going to go ahead and go to my visual, which is from Phillips Lifeline, an article written in 2012, states that fatal, non-fatal fall injuries among people 65 and above, there's 1% that actually died, and that was 12,800 people. 24,000 that were treated in the ED and hospitalized, meaning that they were not safe enough to go home and they had to be kept. 76% that were treated in the ED and released, but working previously in the ER, I do know that doesn't mean they're necessarily not hurt or that they didn't have a head injury, but that they were capable of going home with proper pain medication and a follow-up with a primary care or maybe an orthopedic surgeon. Altogether, these three equal 1.6 million, but they're not quite accurate because we know that there are millions more that do not actually report due to the simple fact that they're scared that they may lose independence if they say that they have fallen, or caregivers that did not properly report a fall in a facility or in a home health care situation. So with all of these, 1.6 million is a really high number, and prevention is key, and that's what leads us to my next point, saying that prevention of falls can be maintained with assessment, which is detection of risk factors and a decline in the health status. Annual checkups with your primary care physician are needed to detect any diseases or disorders with no delay. It's important to take somebody with you to these appointments, especially a caregiver or a family member. You should ask lots of questions, especially when it comes to pain or confusion or just not feeling right. The CDC, an article that was written in 2015, again says to have elderly patients ask their doctors or pharmacy to review their medicines to see if anything might make them dizzy or sleepy. This should include medicines that are over the counter because they also have an interaction with some of the prescription meds, and not just narcotics and other prescribed meds are the only source to some of the problems that cause these. The older adult should also be assessed yearly for vision problems. They have magnifying tools, glasses, anything to help with the decline in vision. Night lights are a great thing. It's not uncommon to have an elderly patient get up multiple times in the middle of the night to use the restroom, and going from a dark room and then to a lit bathroom or hallway, the reflexes in your eyes just don't quite go as fast as they were when we were younger, and they do not accommodate, which leads a higher risk to a fall. But yes, so proper lighting in hallways, especially on stairways and in and out of light and dark areas, is important. Issues with gait can also be a problem, and there's assistive devices for those as well. There's walkers, there's canes, there's reclining chairs that help get in and up when it's hard to push from a lower area to a higher area. Stairs that should have stairways that have railings, and bathrooms have railings as well to help get in and out of the showers and the bathtubs. They've even got to the point where they paint one side of the stair and this side of the stair different colors, so it's easier to differentiate where you put your foot as you're walking up or down the stairs. Attending to physical therapy is also important. These employees are trained to teach the elderly how to control their movements and to help get strength in their muscles again so that they can control their movements better. Studies show that falls in older adults are often caused by a decline in physiological factors. These factors can be significantly decreased with proper assessment and prevention beforehand. There are many risk factors for the elderly population with deterioration of health and can lead to a fall, though proper management of health prevention and assessment ahead of time can help lessen these. So as a member of the older population, and knowing that our health declines as we get older and that we can't outdo that no matter what, we should take assessment and evaluation early to detect disease and disorders so that we can prevent them and put the odds in our favor. But thank you.